In this lecture, we are going to review teen pregnancy and parenthood. Each year in the United States, roughly 750,000 girls under the age of 20, or about 9% of all teenage girls, become pregnant. In 2008, of 746,000 teen pregnancies, 440,000 resulted in birth, 189,000 in abortion, and 108,000 in miscarriage. The good news is, this is the lowest teen birth rate since the government started keeping these records around 1950. The bad news is, teen pregnancy and birth are still a terribly difficult situation for the girl and her family. And fully 18% of girls give birth before age 20. The decline in teen pregnancy rates is due to two factors: teens' increasingly consistent use of contraceptives, and more teens choosing to delay sexual activity to later ages. Despite these positive trends, the U.S. teen pregnancy rate is one of the highest among developed nations. For example, the U.S. rate is 3 times the rate in Canada and 4 times the rate in Italy. Why is teenage pregnancy a major social problem? First, if a birth results, it is likely that the child will be raised for at least a few years by single mothers who are too young for the responsibility. Second, teen childbearing is associated with adverse economic conditions. Teenagers who give birth are much more likely to live in low-income families. Poverty and high rates of unemployment in poor neighborhoods lower young people's educational and occupational aspirations. Girls growing up in these circumstances perceive a greater likelihood that they will have a non-marital birth while they are young. Third, the pregnancy and birth often interfere with the mother's schooling so that she may not complete high school or does not go on to get the necessary training for a good job so that she can support herself and her child. A study of women who gave birth in 1977 followed them for 30 years and measured economic outcomes at age 30. Early motherhood, given birth before age 20, was associated with economic disadvantage at age 30, including fewer hours of paid work, greater likelihood of receiving welfare, 23% less annual income, and greater economic insecurity. Psychologist Frank Furstenberg and his colleagues conducted the classic study of teenage childbearing, which gave essential information on its effects of the mother and her child. The study is particularly impressive because it followed up on women and their children 17 years after the women were initially interviewed while pregnant. There were approximately 400 respondents. All of them initially residing in Baltimore, and most of them were Black. The study concluded that although there were many negative consequences to teenage childbearing, they have been exaggerated and insufficient attention has been paid to the women who, despite the odds against them, managed to cope with adversity and to succeed. The study shows clearly that there is great diversity in the outcomes of adolescent mothers. Some remain locked in poverty for the rest of their lives, whereas others manage to succeed despite their circumstances. The most important factor is differential outcomes. Girls with better educated parents who have more income tend to do better because they have more resources on which to draw from. The second most important factor is competence and motivation. The girls who were doing well in school at the time of their pregnancy and had high educational aspirations were more likely to do well following the birth. A third factor is intervention programs, such as special schools for pregnant teenagers and hospital intervention programs. When those programs are successful, they help the girls complete high school and postpone other births. Two factors that are crucial to recovering from the adverse circumstances of a teenage pregnancy. If there are additional births soon after the first, the girl essentially becomes locked out of the job market. The data indicate that the children are at risk in many ways. At birth, 17% were at low birth rate, which puts them at risk for a variety of other problems. However, it seems that the excess of low birth weight babies is more a function of the inadequacy of medical care during pregnancy than it is a function of the mother being a teenager. Many teen mothers are from disadvantaged socioeconomic backgrounds. This raises the questions of the relative contribution of teenage parenting versus poverty to the outcomes of the research. Now, one attempt to control for the effects of context compared teens who became pregnant but miscarried with teens who gave birth and kept their child. The results indicated that those who gave birth did well, and in some cases better, in subsequent years compared to those who had been pregnant but miscarried. These findings suggest that it is not much the teenage childbearing, but the adverse social and economic circumstances associated with teenage pregnancy that have the negative effects. Nonetheless, teenage pregnancy and childbearing will continue. In summary, teenage pregnancy and childbearing is a serious problem, but not insurmountable. By studying women who stage a recovery from the experience, we can gain important insights into how we can break the cycle of poverty and teenage pregnancy.